Dialysis. This word inspires fear in patients with kidney disease. In fact, it should be the opposite. Dialysis is the lifeline in kidney failure treatment. I want to demystify this today. I am Dr. Tanmay Pandya and I am a nephrologist. Dialysis is basically purification of the blood when kidneys do not remove the waste products that it is supposed to remove. This is done with the help of a filter and blood flow circuit and a machine. Dialysis is required when kidneys have lost their function to a large extent and that becomes incompatible with a healthy life. A lot of waste products accumulate. Patients develop symptoms like loss of appetite, nausea, vomiting, swelling in the feet, breathing difficulty, itching, hiccups, etc. When these symptoms develop, the waste products need to be removed, and they need to be removed mechanically or physically. They cannot be removed by medicines alone, and that is when dialysis comes in. Dialysis is also required if kidney function is lost all of a sudden. There is a condition known as acute kidney injury, where kidney failure occurs because of various reasons. That could be infection, pregnancy-related complications, post-operative complications, trauma and blood loss, etc. So dialysis is required in even such a case. But whenever a dialysis word is uttered, patients and patients' attendants really get scared. That's not the case. If an organ fails, it has to be replaced by some means. And amongst all organ failures, kidney failure is the most easy to treat with the help of this therapy, which is known as dialysis. If somebody has a broken bone, that needs to be treated by screws and plates. If somebody has got a blocked artery, maybe a stent has to be placed. Similarly, if one's kidneys have failed to a large extent, then dialysis is just another form of therapy. Nothing to be afraid about. Also, there is a myth about dialysis that dialysis once started will continue for life. This may be true in a lot of cases, but in not all cases. In acute kidney injury, which I was talking about just now, dialysis is done for a limited amount of time, for a limited period, and after that, as the kidneys recover, dialysis can be stopped altogether. When required, dialysis has to be done multiple times in a week. We recommend 3 times in a week dialysis. Sometimes when the urine output is good, 2 times in a week dialysis can also be done. Also, there are different modalities of dialysis depending upon the hospital setting, the patient's condition, patient's preference, etc. And we are going to talk about these modalities of dialysis in a different video. Thank you.